this module, we're going to be talking about breaking the silence on mental health in the Korean American community. You're listening to this probably because you want to help your church with their mental health, right? Maybe you know a church member who's depressed, so you want to hear what you can do to support them. Maybe there was that one time someone was threatening to hurt themselves. Your staff counseled them through it. That was really stressful, and you'd like to be more prepared if that ever happens again. Maybe you've even dealt with a crisis situation, a scary time when someone was going through a manic episode. You were utterly lost about what was happening. Do these instances stand out as exceptions in your mind? Because if you're like most people, when we think of mental health, we assume these concerns affect a certain kind of person. Certainly not everybody. Does it affect you? Whose mental health are we talking about anyway? If you think mental health is relevant for certain people more than others, then this module is especially for you. So by the end of this module, your perception may expand a little bit because we're going to understand first what stigma is, what that taboo feeling around mental health issues is about in the first place. Secondly, we're going to understand how our attitudes and our lack of understanding work to keep very real mental health needs hidden and unmet, which really ends up hurting us as a church by keeping us in the stance of putting up a facade of everything is great, when we know that this false self-sufficiency is not aligned with our need for God. And third, we're going to know how to combat these fears and start making it okay for people to feel seen and supported in a deeper way by normalizing our mental health needs as just another reflection of our undeniable need for God. So let's get started. Stigma was first defined by a sociologist by the name of Irving Goffman. And he explained that stigma around mental illness is the situation of the individual who is disqualified from full social acceptance. So in essence, it's about social rejection. It comes from having something defective about you. And he went on to say that it does this because it reduces someone from a whole and usual person to a tainted and discounted one. So we're talking about people's self-worth and value as a human being. And the truth is, I think we know exactly what he's talking about, right? What images and stereotypes come to your mind when you think of a, quote, mentally ill person, right? Maybe you think of old movies where a patient is strapped in a straitjacket in a mental institution, or you imagine a homeless person talking to themselves, right, on the street corner, looking disheveled and rocking back and forth. Or you think of someone who's violent and dangerous, like someone who shoots up a school. The undertone is often fear, right? Fear that the person is crazy. Once someone has that label of crazy put on them, which is driven by fear of what we don't understand, it becomes very difficult for people with this label to feel a sense of belonging. It's like they're judged as being inferior or as someone everyone wants to avoid. Nobody wants to be an outcast. It's very threatening to us as social beings. And so we do everything we can to avoid being stigmatized in this way. Research shows that these fears are very prevalent in the Korean American community. There are studies that have looked at attitudes about mental health disorders and attitudes about mental health service use. And they show that Korean Americans who have negative attitudes believe that depression is a sign of personal weakness. In other words, that mental health struggles are really a character flaw, right, of not being strong enough, not being resilient enough, disciplined enough, smart enough to get your act together, and on and on. And Korean Americans who have these negative attitudes about mental health issues also believe that having a family member with a mental health disorder brings shame to the whole family. And it's somehow a reflection of the family as a whole, something that's not to be shared or talked about with others. For example, there's also studies that link these kinds of negative attitudes about mental health with things like fear of hurting future marriage prospects for their children, or even for the siblings of the family member with a mental health disorder. This idea that nobody would want to marry into a family that is tainted in this way. These are really deeply embedded fears we're talking about. We also know that older adults are more subject to these negative attitudes and beliefs. How does this stigma really hurt us, though, right? You may be thinking, well, these negative attitudes, they're understandable. It doesn't seem like there's any way to really change them. Now, the problem is that these negative attitudes, judgments, and fears keep us silent when we or others we know are suffering. And when we stay silent, it leads to all kinds of other serious problems. We know that Korean Americans have low awareness of mental health issues overall, whether it's how to recognize warning signs of when your emotional well-being isn't really in good shape, or recognizing what mental health disorders can look like. Korean Americans are just not very well informed. Research shows us that not only do Asian Americans have the lowest rates of using mental health services compared to other races, but even among Asian Americans, some studies have found that Korean Americans have higher rates of distress compared to other East Asian ethnic groups. Even though we've been found to have greater rates of depression, anxiety, and suicide, we still don't seek professional help. Whether it's seeing a counselor, taking an antidepressant from your doctor, right? It would be one thing if we didn't have as many mental health needs as the general population, but that's not even the case. We have significant mental health needs as Korean Americans, just like everyone else, in addition to a ton of barriers to seeking help. And there's a lot of cultural reasons for this, like Han, which some scholars have defined as our collective trauma and memories of suffering because of the oppression that we've endured over the course of, our 5,000 year history. And I don't have time to get into Han in this module, but there's a lot of literature on our historical trauma and the ways that we've learned to cope with suffering for many generations through this idea of constant sacrifice and endurance. But this perpetuates a pattern where we normalize our pain and try to demonstrate self-reliance instead. And while there's nothing wrong with having resilience, sometimes the unintended consequence of this pattern to just automatically suck it up and press on constantly is that it causes us to ignore red flags and to miss signs that our distress is not being managed in a healthy way. And this kind of delay in help seeking is shown to lead to worsening symptoms over time that could have been taken care of if we had just done something about it earlier. And this is why studies have shown that Asian Americans, including Korean Americans, actually have higher rates of severe psychiatric disorders by the time they finally do access the mental health system compared to the general population. Families wait until the last resort when things have escalated beyond their capacity to manage their loved one's struggles, and they're in crisis mode before they finally seek help. That's why some studies show that Asian Americans have the lowest rates of service use, but when they do access treatment, it comes in the form of higher rates of emergency room visits with a psychiatric-related crisis than the general population. This also makes effective treatment more difficult and makes recovery take even longer. This kind of silence, waiting for things to get better by themselves on their own and ignoring pain, it's also problematic because we have countless Korean American families who are suffering alone with shame